Boris, thank you so much for joining us today. So we're speaking to you from Bulgaria. Do I understand that correctly?
Hi, Mike. I'm originally from Bulgaria, but I live in Malta for the last 5 years. As you're going to see, a lot of our team we're Bulgarians, but we live across Europe in various countries in Europe. So we believe we're actually a true international team.
That's absolutely beautiful, and that really embodies the European spirit. It's a story that we hear with every one of these, right? That you're from Bulgaria, but you're Malta and you're distributed. So tell us about your solution. I mean, you're addressing a very critical issue right now. People want to help, but they don't know where to help or what to do.
Exactly. We noticed very early in the development of the crisis that a lot of people really are trying to help, and they're doing absolutely amazing job. Volunteers all around the world, not only in Europe, in the States, and every single country in the world, which is right now having problems with the COVID-19 crisis. But it's a difficult task when you're faced with a real crisis, a crisis which actually even governments cannot really cope with, because it puts to the ultimate stress all the existing systems for healthcare and just social constructs and political systems on every level possible. And also, we're coming from a country which Bulgaria is one of the poorest countries in the EU, and there is, even in the EU and a lot of other countries, not only in Europe but in Europe and outside of Europe, are anyway for years and years relying on donations and charity and development programs to just get the necessities in terms of medical equipment and supply, or just to increase the level of their healthcare. So we were aware from this problem, for many years. A lot of us have family in the medical industry and doctors. And we already were seeing this in Bulgaria and in other countries, that just there is no data of actually what's needed to help. So you're trying to help, but you just cannot understand where. So you're scrambling resources and you're trying, and it just takes such a big overhead of efforts and money, really. And now we saw this even in the most developed healthcare systems and economies in the world, that they just couldn't cope because there is no available data about what the hospitals need actually. There is no available data of what suppliers are right now on the market and where they can deliver today and what they can deliver today. Things like what certificates they have, like it's all data which is very fragmented and very scattered, if existing at all. And then the charities themselves and the volunteering organizations and foundations, there are so many, and there's new ones every day, and they're doing amazing job. But it's hard to coordinate between each other, and this creates again a lot of overhead, which is costing money, it's costing time, and their work can be way more effective. And they were actively outreaching for help in terms of how to organize and collect their data. So this is why we started that project, and this is where we came in.
Beautiful. So I'm remembering, it's amazing that we have a memory of this crisis, right? The beginning, that we've been in this so long, and that there was a large effort from the maker community and hardware hackers like me to build ventilators and masks. But then we found out from experience that we were building things the hospital didn't need or want. So your tool is going to help alleviate that, right?
Absolutely. We had so many conversations with people that are on the front lines, and one of the examples they gave immediately was, everybody is now trying to ship us masks, and there's millions of masks, and all the media is talking about masks, but actually need also the face shields, the gloves, the gowns, full protective suits. So this was the first thing they had to really educate people about. Of course, now we see that, but as you said, there is really no visibility of what's really needed, when it's needed, and how it's needed, and who can actually operate it as well, because it takes actually medical staff to operate ventilators. So even if they're needed somewhere, there might be nobody actually to operate them. So it's a really complex problem, and we're really hoping that we're going to be able to help with that.
So Boris, in parting, we want to know, what is the name of your team? So if anyone looks up at the dev post on EUvsVirus, they can see your great work. And do you have a last word for anyone who is interested in participating in hackathons?
Our team is called Aidbind. You can find us indeed on the Hackathon page. We have a lot of details published over there for the project, and if you need any more details, you can just reach out with the provided context there. And about the hackathons, it's been an amazing experience. It's actually my first season of hackathons because we were in 2 hackathons in the 2 weeks before this one. So it was amazing. To be quite frank, we did not actually expect to win the EUvsVirus one, so this was coming with a bit of very positive surprise. And the people that I met and the team that we managed to assemble was completely amazing. So it was an incredible experience, and I think that everybody should join this movement and this way of work to experience it.
Well, Boris, thank you so much for joining us today. We wish you all the best and are really looking forward to the Matchathon process to see which partners join up with your company and your effort.
Thank you, Mike. Thanks a lot for the time as well.